Hello, everyone. My name is Danielle Cahalan. I am here today to speak to you about my research proposal titled Improvement of Type 2 Diabetes Management with Motivational Interviewing, Smart Goal Setting, and Interdisciplinary Communication. Once again, my name is Danielle Cahalan. I'm a graduate student at Grand Canyon University, and this is for Psychology 693 course titled Professional Capstone with Dr. Jim Gregg. And it was submitted on February 28th, 2024. The introduction involves diabetes management and how those diagnosed with a chronic illness can experience distress and overwhelm when diet and lifestyle factors and needs are involved. Psychological tools such as motivational interviewing, MI for short, or SMART goal setting can be applied to help these individuals enable health behavior changes. And while they have been studied independently, they haven't been studied collaboratively and collectively until now. This unique combination of motivational interviewing, SMART goal setting, and interdisciplinary communication. So this study does so as a unique yet comprehensive application, in addition to the pre-existing diabetes self-management education and support checklist, short for or long for DSMES, and that's used by the American Diabetes Association and certified diabetes educators. So the research question posed here is, does implementing a combination of motivational interviewing, SMART goal setting, and interdisciplinary communication increase self-efficacy and intrinsic motivation for diet improvement in managing type 2 diabetes? The alternative hypothesis is a combination of MI, SMART goal setting, and interdisciplinary communication does increase self-efficacy and intrinsic motivation for diet improvements. And the null hypothesis is, since there's not specifically a placebo group, it's more so it's a factorial design. So you will see out of all of the factors and levels involved, which one is most effective. So for instance, the null hypothesis reads, there is no difference between health coaching with unscripted motivational interviewing, one SMART goal set, and monthly interdisciplinary communication applied versus health coaching with scripted motivational interviewing, 2 to 3 SMART goals set per week, and weekly interdisciplinary communication applied to increase self-efficacy and intrinsic motivation for these diet improvements in managing type 2 diabetes. What does the literature say? So for motivational interviewing, I wanted to give a little background. Miller and Rose developed this in the 1980s while observing how others, including their colleagues, they really respond well to be given autonomy over their goals and health decisions as opposed to a prescriptive element. This had more favorable outcomes. And MI gives clients and patients the lead, offering a collaborative approach with the provider. MI entails 4 distinct stages, including engaging, focusing, evoking, and planning. And this concept is to identify sustained talk. So sustained talk is more so ambivalence and resistance and dwelling on what's not working, and mobilizing that individual to engage in their own change talk. And change talk enables them to adopt that growth mindset and help enable them to make these health behavior changes. A study conducted by Killink and Kartal in 2022 displayed that MI conducted over the phone was effective in lowering certain biomarkers, including but not limited to blood pressure, BMI, LDL, and increasing HDL levels, in addition to behavioral outcomes of healthy eating and exercise in those with type 2 diabetes. So we already have evidence displaying here that MI, or motivational interviewing, conducted over the phone does help those with type 2 diabetes in managing their chronic illness. You'll see the graphic on the right here. There's a difference between intrinsic motivation, or from within, giving the client and patient more autonomy, mastery, and purpose, where the counterpart to that is extrinsic motivation, or coming from the outside. And that involves more compensation, punishment, reward. I can even add fear there, but we really want to focus on the motivation coming from within, because that's more sustainable and long-term. So the literature review for SMART goal setting entails SMART being an acronym, as most of us know, and it stands for specific, manageable, attainable, realistic, and time-bound. This style and structure of goal setting allows for goals to yield improved outcomes more frequently and to aid in creating sustainable behavior changes. So, in a study by Cook and team in 2022, a cohort of 100 patients with type 2 diabetes enrolled in a 3-month program. And my study will be 3 months in length as well. And this prompted SMART goal setting. The results displayed that an average of 1.7 SMART goals set per week resulted in 30% of the patients achieving their A1C goal and a reduction of 1.2% overall. And just to give you a little bit of a background on, A1C ranges and the significance of 1.2% reduction, a healthy range of A1C is below 5.7, and prediabetes is between 5.7 and 6.4. Type 2 diabetes is 6.5 and above. So you can see here, it depends on where you are within that range span, but 1.2% can be significant in the difference between being pre-diabetic or diabetic and going to the pre-diabetic or normal range category. And interdisciplinary communication. So Trujillo, Garrido, and Santi Cano from 2022 discuss provider communication challenges currently. So these challenges include lack of sufficient chart notes and documentation for the need of dietary intervention and lack of a referral to a dietitian who is a nutrition expert in their respective field, and the absence of interdisciplinary communication among a patient's care team in general. Now, I can speak directly to this since I have worked in the clinical setting, and since each party is already busy enough in their area of expertise, it can be difficult to add this element, but it is a crucial part that should be included in job descriptions for everyone on the care team to collaboratively work together and keep each provider informed so everyone is on the same page to elevate patient care. In a study of 107 adults, Wazowitz et al. From 2021 show that negative emotions influence poor dietary choices and that working with a dietitian or health coach can support these. And the patient's care team should remain in open communication with one another for optimal patient care, as I was saying. So for my study, the methods and data collection, participants, there's going to be 80 participants, will be recruited through advertisement via email, social media outlets such as LinkedIn, and word of mouth promotion. Criteria will be both men and women, a mix, hopefully as equal as possible. Age 25 to 65. The cutoff is 65 because the elderly population, the requirements for A1C and range references actually are a little bit higher. So that will be different and difficult to track. That would be considered a confounding variable that we need to account for. So to make things easy, ages 25 to 65 is appropriate. And those diagnosed with type 2 diabetes at least a year prior to mitigate some of that diabetes distress or mental health concerns associated with it. So the client or patient is fully ready to commit to these health behavior changes after processing their diagnosis. The study design is a 2x2x2 factorial experimental design. And so this just means that there are 3 factors with 2 levels. And there are 8 groups of between subjects. So each group has different participants in it. And they will be assigned to one of the following assignments that you see to the right, table 2. Table 1 for this presentation, but in my paper it was table 2. And you can see that the different groups are a different combination of either generic versus organic motivational interviewing. So generic is just kind of like this scripted, organic is more fluid. 1 or 2 SMART goals set per week, and then weekly or monthly interdisciplinary communication. The operationalized variables, the independent variables are motivational interviewing, a guide or script for that versus the kind of organic fluid one. 1 to 2 goals, SMART goals set per week. Interdisciplinary communication, so weekly or monthly. And the dependent variables that are open to change as a result include increases in diet score from the food frequency questionnaire, which I gave a little preview, a little screenshot of what this questionnaire would look like. It is self-reported from the participants. So it is supposed to be quantitative, right, and objective, but it's there is room for error when it comes to self-reporting and just misremembering. So just to note that. But you can see it gives a range of average of what the person is consuming for each category. And this food frequency questionnaire is 5 pages in length, so it's pretty comprehensive. Another dependent variable is A1C, or an average of blood sugar over the course of 3 months, which is perfect because that aligns with the length of the program, which is 3 months. And self-motivation that is subjectively reported in the pre and post test on a Likert scale. The hypothetical data, presentation, and findings. So a 3-way ANOVA will compare the 8 experimental groups and various combinations of motivational interviewing, SMART goal set, and interdisciplinary communication frequency. The hypothetical data, as you can see to the right, displays that all combinations of applications are statistically significant at a p-value of less than 0.05, aside from SMART goal setting paired with only interdisciplinary communication. So they're all effective in a set of 3, but not just those 2 paired together. Overall, I'll go on the next page for discussion page of what the optimal combination is. And then similarly, A1C levels in those groups were reduced by an average of 2.5% overall as well. So this combination is effective in enabling participants with type 2 diabetes to help lower their A1C and control their blood sugar levels. Discussion, it's clear that a group with scripted MI, so some prompts and guidelines of what to cover, 2 SMART goals set per week, and interdisciplinary communication with a provider once a week to the care team was optimal in yielding desirable results from the participants. These results displayed improvement in dietary intake and reduction on average of 2.5% in one's A1C over the course of a 12-week or 3-month program, virtual health coaching program. Future research. So we must account for the environment, face-to-face and in-person versus these virtual appointments. Does that make a difference? Sometimes people feel more comfortable with either method, especially with technology growing and people getting comfortable with technology and virtual appointments. So I would like to see for future research comparing those 2 methods and applications. Limitations of the study was that it did not account for social determinants of health, which can be a big factor in terms of socioeconomic status, access to fresh, whole foods, nutritious foods. The list goes on and on. So that might be something to explore, just screen on in future studies. The study also did not account for mental distress associated with the participant's diagnosis. This is another screen that could easily be added before starting the study with the informed consent, just to make sure that the person is psychologically well to take on what's being asked of them. And further research is needed on how to further support intrinsic motivation while managing a chronic disease and condition in a clinical setting. The conclusion, over a 12-week, 3-month period, participants with type 2 diabetes displayed an increase in self-motivation through an improvement in diet scores with the food frequency questionnaire and an average of 2.5% lower A1C levels after adhering to this program, consisting of motivational interviewing, specifically the scripted one, setting 1 to 2 SMART goals per week, specifically 2 SMART goals per week, and the health coach engaging in weekly interdisciplinary communication. These are my references. Thank you so much for your time and energy in listening to this presentation. I appreciate it.